We are going to ask that if you're not speaking right now, that you go ahead and go on mute. It looks like we have quite a mix here today. This is fantastic. A mix of systems administrators, support organizations, association network leaders, home-based childcare providers, community leaders, advocates, and philanthropy. This is fantastic. And as Gina's mentioned, please go ahead and feel free to say hello in the chat. I want to move on to introduce us. My name is Danielle Fuentes Johnson, and I am a Learning Communities Technical Specialist with the BUILD Initiative. My projects that I have had the pleasure of working with at BUILD include home-based childcare, as well as emerging English language learners and immigration trauma. And I'm joined today by my partner in this work, Gina Capito. And Gina has been a consultant with BUILD for just about a decade and has led various projects, including home-based childcare, fiscal mapping, early childhood systems building, early Head Start and Head Start partnerships. And she also leads the Home Visiting Alliance and the Prenatal to 5 fiscal strategies, and serves as a state lead for the Pritzker Children's Initiative Hub. And we are pleased to be joined as well by Jessica Rodriguez Dugan, who also comes from a background of early Head Start and Head Start partnership grants and directly implementing those with the grantees. She's been a consultant with BUILD for a while and has extensive knowledge in early childhood systems building, home visiting, and also serves as a state lead with the Pritzker Children's Initiative Hub. And now I'm going to turn it over to Gina, who is going to give us a snapshot of which states are with us and communities have joined us, and an overview of what we envision this community of practice to entail and what we look forward to digging in more deeply with you in this work.
Hi, everyone. We are so excited by today. We have been planning for and hoping for something where a group of committed partners would be able to really do deep work on family childcare, home-based childcare settings that are defined in part by you, supported by quality standards, as well as beliefs about what is integral to doing this work and how important it is that we approach it, and that would go deeper than webinars. I know many of you have participated in the webinars that Danielle and I have been able to do as part of the BUILD initiative over the course of the last 7 months or so now, as well as possibly participated in some of the different TA opportunities. But we've always felt like we were just sort of like nipping at the heels of the discussions, the depth of those, what those discussions should look like, and the types of supports that would be really tailored to where you were as individual states and communities, instead of having that opportunity to and just kind of having to take those opportunities to say, okay, well, we can do some webinars, let's do it, because it's an important topic and we should get out there with those webinars. But this community of practice affords us a different opportunity, we believe, regarding how we can come at this work related to family childcare. And so we are just thrilled to have you all here with us on this sort of maiden voyage of sorts as we go a little bit deeper. And I'll talk more about what's a little bit different about this community of practice when we get to those slides. But we just wanted to share with you the snapshot of who we have with us for the duration of our relationship. And you see in the case of California, they're shaded gray for a couple of reasons. One, we wanted to note that in this particular community of practice, we have both state and community level or regional teams. So that's not only states that are participating. So we wanted to kind of draw out the idea that there would actually be 2 different communities from within the state of California. And those folks are going to be joining us in our January activities. There, as many of you were kind of getting your applications in just that week right before Thanksgiving, and we were so excited to be able to welcome you. We also acknowledge that some of the getting the date on everyone's calendar and getting all the elements of the community of practice launched with a new team takes time. And so we're not closing the door to adding on our California friends starting in January, and we'll get them up to speed, of course, on what that looks like going forward. But you see, we have a nice representation of states from across the regions of the country, as well as folks that are in different places of doing this work, but are committed to a set of beliefs around what this work will look like going forward and how you approach the work for your state or community going forward. So let's talk a little bit about what this community of practice is. So one of the things that we do like to ensure that we've done is we have a moment where we all are kind of a level set, that we're all on the same page with some of like what the core concept is of a community of practice. We know that in many instances you've been involved in communities of practice, peer learning groups, learning tables. There's lots of different terms that are used. Sometimes they're used interchangeably. Sometimes they have really clear definitions or differences across them. And certainly as an organization, Build and the NCIT Hub both have pretty clear parameters around what our intention is of this work. And so we wanted to share this with you as part of making sure there's a goodness of fit between your team and what the community of practice can bring, and how you're such a core part of the success of the community of practice. So really understanding sort of what it is that we're working on as a community of practice is really an important piece for you to hold that value as well. So we're going to talk more about this idea of a core set of beliefs, and that's going to be actually a frame or an anchor for us going forward through all of our content. So we're going to introduce a set of beliefs as part of today and as part of how you introduce yourselves to each other and get to know each other. We're going to use those core beliefs as a frame for that. But some of these other elements of what a community of practice is, they're pretty standard. Of course, we need a group of folks that are interested in working across a shared issue area. And that are looking for that balance of being exposed to new content or being exposed to experts and folks that have had experience with some of the different elements of the work, as well as then being interested in working on your individual issues or responses that you're trying to make as a state or community. We need that balance in order to be learning and growing from each other. And then I think the biggest thing, and we asked all of you that we were able to, if we didn't do a one-on-one call with you as a rep from your state or community team, there's someone involved in your state or community team that we did have a quick half-hour phone call where we sort of talked a little bit about what you were hoping to achieve. And part of that was to get an understanding, again, around that idea of goodness of fit, but also to really think about what your kind of readiness or prepared to be digging in on this topical area and really doing some deeper work around it, what that looks like for you as a state or community. So we took those very informal conversations just as an opportunity to do that, learn a little bit more about you, as well as answer questions about the community of practice, and then speak with your state or community applicant around what the team would look like, because that's also something that we're approaching slightly different than other communities of practice, where, and very much driven by what the goals of you're trying to achieve when you launch a community of practice, you often will say we need really small teams and we want to keep the number of participants small in the community of practice because we want to ensure that there is the opportunity for open dialogue and that everyone has space to speak. So, you don't want a group of 100 trying to have intense personal kind of relationship-based discussions if we're doing like racial disparities, community of practice. In this particular instance, when we think about how we approach family childcare and how the leadership for home-based care evolves in our states and communities, we acknowledge that there is such sort of a disconnect between where the leaders are and the folks that have the most knowledge and on-the-ground experience with being a home-based care provider, and where oftentimes the decision-making and power is held within a state. And so what we wanted to allow for is that your teams may need to be a little bit bigger so that you could engage at those multiple levels, and that you could engage them more authentically than saying that we just are going to we'll go ask family childcare providers what they think about it and we'll bring it back to the community of practice to allow you the space to determine who are the right participants to sit at as part of this community of practice. So that's something that's a little bit different about this group. So your teams won't all look the same. And it's not as if you'll all have your CCDF administrator and then 2 or 3 other positions that Danielle and Jessica and I defined. Instead, we had those conversations with you to think about who makes sense and who do you believe at this point in time are the right folks to be part of the team for your community of practice. The other element that we have talked about with each of you, and I want to make sure that it's clear as we move forward, is that there's probably different ways that you will engage people across the work. So there may be folks that are going to join and participate in some of your team activities that are not at today's meeting, and maybe they won't join in January, maybe they'll come to an individualized TA call in February, and that will be their first point of contact, but maybe they won't participate in more of the webinar style content. They'll do more of that one-on-one TA that we're going to be working with you around. We fully support you in that, and we want to offer the opportunity for you to be thoughtful about what that may look like, and if there's any sort of like lead in or intro that those individuals will need to be able to come in to kind of step in and out of possibly of the community of practice, that we support you in that effort as well. So we're offering much more shades of gray in how we do this community of practice than often does, which we hope will be then more responsive to how you go about the work in your state and what is right for you around where you are right now with the work. But we also acknowledge that that always leaves us all like, wait, what am I allowed? What's the rule? What am I allowed to do? Because we're all so accustomed to having parameters and frames and, you know, sort of being told what to do. So we want to work with you around that. So don't hesitate to reach out to any of Jessica or Danielle and I at any time with any questions or processing thoughts on that. Happy to help in any way. And so then the other thing that I wanted to talk a little bit about today before we move into then talking about what some of that work together will look like is some of the topical areas that engaging in this work could cover. And it's really a few big areas. We know that when we think about supports for family childcare and we think about the current systems that we have in place and how we engage in this work, they really kind of cluster into big areas of focus. Quality and the quality of care, the quality systems that are available to support that care is one. We're going to talk about this here for a second. The next is really then the systems or the infrastructure that supports the work that you're doing or maybe isn't built as robustly as it needs to be to support the work. And then fiscal, because it always involves money to some extent, as we all well know. So we share these things at this outset of the community of practice, in part as in a couple minutes, we're going to have each of you tell us a little bit about your team and the goals that you're seeing currently as you approach the community of practice, as you introduce yourselves to each other. And so just to give you a little bit of a flavor of where we typically see the work clustering when we approach it. And so quality systems we know involve frequently thinking about the standards that exist for quality in childcare in the state, how those include or how intentionally the process for creating those included family childcare settings and whether or not it did, and sort of what that's meant as you've implemented those standards in the state. And maybe you're trying to kind of look backwards and then include family childcare now. So understanding some of those nuances of where things like that came from and how they have integrated in family childcare is a big element of thinking about how we're supporting quality. And so some of what we will then bring to bear through the course of the community of practice is examples and topical experts and folks that have experience with some of these quality elements that you can pick their brains, you can ask them questions, they can present the strategies that they've used, but all along the way, the goal here is for you to be thinking about how these things are useful to you, how they can be leveraged within the work that you're trying to achieve, and what your immediate next steps may need to be with these concepts and ideas in mind. The next area, as I mentioned, then is the overall infrastructure or system of supports. So, and this is a big element that goes across several pieces of the work, certainly. It's kind of what is your overall plan for how you approach supporting family childcare? And we know that an element of that would be the quality of the delivery of the services. But then we also know that there are other pieces of that mapping out an approach that are critical to then thinking about how family childcare is part of the fabric of your system and how you are carrying out or working under a shared plan for supporting family childcare that raises up those family childcare leaders and voices in a way that is really driving the work. So it's not a childcare plan that maybe focuses more on center-based care and family childcare just happens to be sort of in the fold, but not really driving or having a core say in it. And so some of the things around supporting family childcare and thinking about that infrastructure style of do you have the pieces in place to really support family childcare well, include a plan. They can include really understanding how you approach the services or supports for family childcare from a relationship-based approach. Because you're often talking about a small business owner who is a shop of one, maybe 1.5 if they have a part-time assistant or even a full-time assistant, it's still a pretty small shop that you're usually working with. And we know that relationship-based practices are critical to how successful the strategies that we use to support family childcare is. And then really understanding what types of supports you have in place and sort of mapping those against each other. That's another activity that we find many states and communities reach a point that they need to do. There's been awareness of the need for supports for family childcare, and things have been added over the years, or family childcare has been included in different initiatives over the years. But how these things all align together and assessing where the gaps are when we look at it, because what we find is that in many places there's a feeling of there's several things going on for family childcare, but we're still missing the mark. We still have a decline issue. We still have an issue of that we don't see new individuals choosing to become family childcare providers. So with some of the kind of problem statements that we are facing as states and communities, looking at what's already in place to support family childcare, there has to be that sort of an analysis. There has to be a pause where it's all kind of put together in one place, and you really consider, okay, so if we have these things, yet we still have these issues or problem areas, how is there maybe not a match between what we're doing and what we're hoping that the outcomes will be, and where do we pivot? Where can we change in order to address that differently? And I want to say, as we move to the next slide on fiscal, that you will hear us, and our slides do it as well, move in and out of family childcare, home-based childcare. The name of the community of practice includes home-based childcare in its title. Family friend and neighbor care, license exempt. We probably won't move in and out of those terms as often, but I want to make the statement about sort of what we call it. We are intentionally using more than one term for it, because we know that within states, you have your own approaches for, and oftentimes it has a lot to do with whether or not, it has a lot to do with regulations, license exempt, what are the qualifications or requirements of a provider when they are serving X number of children, they then move into a different category of provider. We also know that in all our states and communities, there's a population of family, friend, and neighbor or kith and kin providers, yet there's a lot of variation in how states support those providers, how they're engaged in the system, if they're able to access public funding for the support of the care they deliver. All of those things vary across your states and communities. So this is another place where, through our community of practice, we feel it's important to cast an inclusive or wide net that is, again, very much driven by you, driven by what you're working on, how your state structures things, and gives you an opportunity to hear more from each other on different ways that maybe if you're in a state where supporting family, friend, and neighbor care isn't as much of an option, you get to hear from a state that is taking approaches to support FFN and how they've integrated those into the fabric of what they're doing. So there's some opportunities here. So we are intentionally using different terms in a somewhat interchangeable way in order to be able to have that broader umbrella to this idea. The one thing that we can say to make it a little clearer for folks that also maybe straddle into the home visiting space, which both Jessica and I do a lot of work with home visiting as well as home-based childcare, is that this is a community of practice that is focused on the delivery of care, early learning, and childcare in families' homes. It is not a home visiting model or home visiting community of practice that we're doing. So that's one distinction that I can give you, especially for many of you whose faces are familiar from other tables and work that we are involved in, that you may also see me as a home visiting person too. So I just want to make that clarification. And so another area as we're engaging in this work together is then, of course, in fiscal. And this ties in very much to thinking about those support or infrastructure components that are in place in your states and communities and how they function and how they are supported, how they are financed, frankly, right? It comes down to understanding that as well. And so some of the work can include understanding the actual cost of care and how what family child care costs to deliver. It can also then include thinking about what is the actual cost to deliver the types of supports that you want to deliver to family child care. And we often do this with pilots or short-term initiatives that we build something and we're able to have it funded for a short period of time. And several of you may be involved in this right now with your PDG expansion dollars, where you've got pilots of things that you want to launch. And part of what you may be concerned about is what happens after the third year of that grant. And they, of course, they ask you about sustainability, right? It's one of the things that you have to write about when you pursue the funds. And this could be an opportunity for you to really think about, okay, we can go, what is incremental increasing of the pilot past the PDG funds? What's the total cost that we're talking about? How do we break that out over a 5-year plan? Those are the types of things that you may bring to this work as some of the things that you're grappling with that tie into that idea of how you're doing good supports for home-based childcare and what that looks like within your state structure. So one of the things that we've talked a fair amount about is the fact that this COP does look and feel a little bit different. And the big way that that look or feel comes from is the idea of our individualized technical assistance. And so this is the piece where, when I was just referring to things that you may be working on individually within your state or community team and how we may have a role with you on that, it's through this individualized TA. So you may be more familiar with communities of practice where you meet maybe quarterly and the group comes together, hears from a topical expert, does some processing of the content. We're looking for, and as we've talked to all the states about, we're looking for a little bit more of an intensive commitment, and we asked you all that in the application and everybody said yes. So we made that goodness of fit across us. that there would be this opportunity for parts of our connection would be around the individualized TA. So right now we're thinking about probably an every other month approach, and whether every other month you would have deep technical assistance from Danielle or Jessica is not necessarily exactly how it would play out, but every other month you will have an activity like this where we are together as the full community of practice, and we're doing some processing and peer-to-peer supports and things like that. On the off month from those months, that would be when, if it's appropriate for what your state is working on, we may be facilitating a peer meeting of 2 or 3 states together to go deeper on a particular topic that several of you are working on that you have in common. We may be doing some of that analysis of what are your FCC supports, or offering you resource tools to do that analysis in state, and then doing some processing with you of what you learn when you kind of map out everything that you have available for family childcare. If you're looking to develop a system-wide plan for your family childcare supports, what we may be then doing is sharing resources with you and kind of talking through how do you build the timeline or an approach to the development of that plan and what that would look like in state. So this element of technical assistance truly will be very individualized to what makes sense for your team at a given moment in time, which is why we can't say that necessarily every other month you would be expecting a concrete activity with us around this, but most likely there would be some piece of the individualized TA that would have that ongoing thread and would be woven in with those large group community of practice activities as well. And we're really excited for this work because it is going to be so individualized to where you are as a state, to really be able to then leverage the community of practice full group activities as points to kind of further the work and to really think about, we're struggling with this, let's bring it to the whole community of practice and see if other folks have some ideas on X, Y, or Z. So we really want to try and balance these opportunities against each other and have them build off of each other and strengthen. So we don't have all the answers on exactly what the individualized TA will look like, but we know that we're going to build them with you together. So part of what was there on that last slide was just some examples of what it may look like. And so this is part of what I was sort of laying out, is this idea of what the overall commitment is and how we're envisioning it or structuring it. So we are going to have we have access to and are hosting the webinars that many of you have been a part of over the course of the last 7 months or so. And we're going to continue to use those webinars. In fact, our January activity for the community of practice is going to be building off of the national webinar that we're hosting related to family childcare. And we're planning on doing some debrief immediately after the webinar that's just specific to us as a community of practice to really unpack some of the concepts. And we're going to send you a few questions before you even go into the webinar, so you could be thinking about how you can leverage the debrief after the webinar is over, possibly a little differently than you would if you hadn't gone into the webinar with some resources and some prompting questions. And then, as I mentioned, there'll be those individualized TA. Right now, they're calls or Zoom meetings, because it's all calls or Zoom meetings. So calls or meetings, whatever you want to refer to them as, sharing of resources, email exchanges that will happen in that individualized TA. And then one of the things that we had always hoped for is that we would also leverage national convenings that occur. So I know many of you are familiar with the National Association for Family Childcare, and NAFCC has an annual event, which actually was scheduled to have been in Virginia in summer of 2020. And so there's a few things. BUILD has the national QRIS meeting. There's a few national convenings that we have hopes for in the future that we would be able to maybe add on a half a day at the outset of it, in light of the fact that we'll probably be virtual for the balance of, or obviously the balance of this year, and then possibly a good part of 2021, we still anticipate finding ways to use those national convenings. What we did this past summer with BUILD's 20 sessions in 20 days is, instead of us holding family childcare webinars in the same window of time of those 20 events on the BUILD's QRIS conference, we encouraged all the folks that were part of our audience participating in family childcare webinars to participate in the sessions that were focused on family childcare. We raised up the topical areas so that folks were aware of it, knew how to register for the BUILD event. So just, it was, it's obviously a bit of a punt of a way to leverage the national convenings, but we have a commitment to continue to do that. So we welcome any thoughts on what that looks like too. If there's other convenings or events that you're aware of within state or in your region that you think could be useful for the whole group, we're happy to explore ways that we could leverage those things up as well. So more to come on what that will look like. So as we mentioned at the outset, as we think about a community of practice, one of the biggest things that We have found in work related to not just family childcare, but frankly, systems building work, as well as sort of any work where you're bringing together a set of stakeholders or core actors that come from different perspectives, that come from different vantage points on how the work should be done or what their role is within the work. That one of the big drivers and supports to do the work well is to have a set of core beliefs that you're operating from that guide the decision making throughout the process, that all folks can anchor themselves to. And even with that different vantage point or perspective, find a place within the core belief that their activities or their role within the system drives on that core belief, and really take responsibility for that vantage point or perspective. And so we have 4 core beliefs related to the development of and maintenance of supports for family childcare that we have shared over the course of many months of webinars and activities, and they've been developed also over the course of working with states and communities in their efforts for family childcare, that we think are really important to be guiding principles for the work. And so what we've decided to do as part of the curriculum for the community of practice is to use the core beliefs routinely throughout our engagement with you all. But I want to share or start out sharing them, and then Jessica's going to jump in and talk about some of the core beliefs as well, from this perspective of thinking about them as tools to guide your decision making as well. Because when we think about doing something that is across many different players and has multiple types of audiences or sort of target populations that are invested in an effort, that when we're trying to point towards a North Star together as a group, having a set of core beliefs that everyone is in agreement with may see different paths to how you get there, but still agrees with the core elements of those core beliefs or the fundamentals of those core beliefs. They really can support you in avoiding diverting from what you're trying to achieve, because you've come to consensus, or you know that you have shared beliefs around what you're trying to achieve. It's going to often get really messy between coming to a set of core beliefs and then that end goal of what you're trying to do for, in this case, your family childcare providers. And so in that messy space, which could go on for a very long time when we're all working in systems and working with very complex funding streams and structures that exist for the childcare system, we know that there's going to be places where we're going to be challenged. Is it access versus quality? We don't ever want to say that it's those things versus each other. We need access and we need quality, but we're often put in positions when we're faced with a funding decision or a funding opportunity where it appears that we're having to push on one or the other of those two things. And so what walking through these core beliefs together, what we want you to be thinking a little bit about is how, with these shared and these concepts shared across multiple audiences within your team who may be coming from different perspectives of the work, how that can offer you that rudder to your work, so that then you don't end up with, you may make a decision around access, but you haven't lost your sight line to what the quality that you're trying to achieve is. And so that just really kind of helps you to think about, how are we still holding the core belief? How are we not diverted from it, even if we're focusing on maybe a smaller component of the work within the bigger core beliefs as well. We also find when you're working across large groups of individuals, which eventually, as you broaden out and continue to do the good family childcare work that you're doing within your states and communities with more stakeholders, having a set of core beliefs helps folks to see their role within it and to see that you do share values that they share as well. They don't lose sight of it when they get down into the weeds of the work. And so the first one that we start with here, number 1, really is what may seem like the most basic of concepts, but probably, as all of you have already engaged in and probably have done a lot of deep work in this area over the years of your careers, you probably would acknowledge is one of the most difficult to really address, especially to really address within the current constructs of how our childcare system functions, let alone if we then think about childcare as part of the bigger prenatal to 5 system. There's a lot of aspects of how things are funded, where funding is administered, who has access to different supports, which, whether it's families or provider access. There's a lot of nuances to how the mixed delivery system for early care and education actually functions. And so to be able to say whether or not your family friend and neighbor and your family childcare settings are a full part of the fabric of that early care and education system, it seems like a simple thing to say that we all agree to and believe should be true, but the reality of analyzing or assessing how in practice this is occurring is often where we start to stumble. And it's often the answer when states or communities engage in processes like this and try to really think about decline is our issue. We're really worried about decline. When we start to unpack decline, we come to a place of, well, if family childcare providers are kind of second to your center-based providers, then they're really not part of the fabric of your system. And that could be why it's not an attractive path if you're looking to go into the early care and education setting. And how do we change that? So I think that this one, while it is, and you see that sort of, it's the broadest of the beliefs. And if we can hold true to that and really have this concept kind of routinely guiding decision-making to ensure that we are not diverting from the idea that they are part of the fabric of this mixed delivery system, will help us in a lot of ways and help us to maintain. And I would imagine that there's a fair amount of audiences within your states and communities outside of you all as champions of family childcare that would have a hard time even understanding the nuances of how this one isn't happening. And so there's going to probably be some points of education or messaging that may be necessary at points for individuals to understand why you want to take a particular strategy that really more fully engages that authentic voice of family childcare providers and has them be more of the leader or driver, because you may have individuals that sort of don't even see this idea as an issue because they're just, well, of course they are, right? They deliver care to young children, but they're not really steeped in understanding how oftentimes this is very much an equity issue related to family childcare. It's frequently women of color, low-income communities that are delivering family childcare and family friend and neighbor care. And they are also then the furthest from opportunity as providers, for capacity as providers, and as families and communities in your states and communities. So I think that at times we really just gloss over what the reality of whether or not this is being achieved. And so we hope that we can help to frame all of our thinking from this perspective as our first of our core beliefs. And then the next one kind of continues along naturally in line with this, is this idea of how we resource and build the supports that really carry out the idea that family childcare and family friend and neighbor care are part of the fabric of a mixed delivery system. And so the idea that they are resourced on par with center and school-based settings is a core principle of that. Again, this may be one of those ones that's it's pretty easy to see it in writing and agree to it. It's when we start unpacking and analyzing not just decisions that are to come within how your system functions in this way, but things that are already structurally in place, institutions that already exist, and decisions that have already been made, particularly about funding, that we may see we actually aren't funding them on par, or we've made assumptions about what family childcare costs to deliver. We've made assumptions about the level of resourcing that family childcare providers need in order to maintain quality. And that those assumptions, if we really start to look at doing some fiscal modeling and understanding the resources that they need as providers and that they need in order to deliver high quality care, our assumptions may not be accurate anymore. And then how do we shift how we've been resourced and invest in not just the system to support them, but the providers directly through rates and subsidy payments, for instance, in a way that starts to rectify that issue. And we know that that's not an overnight thing. Without an infusion of new dollars, right? And I don't know where that infusion of new dollars may be coming for all of us. I think we're hopeful that there'll be some more dollars coming through CCDBG. But in all reality, when we really look at the problem compared to what we're currently investing, it's probably a much larger gap than an infusion in CCDBG in 2021 or 2022 is going to solve alone. And then we also know that we need to get out ahead of it. We need to have done some of that education and have the numbers and have an understanding of where we need to shift investments in order to be investing on par with our other settings for early care and education, and also acknowledging that that work needs to involve our authentic family childcare provider voice and the recipients of the care. And so these things take some time to really begin to really unpack and build in response to. And overall, and this isn't just about, it's not like we all just floundered along not doing a good job for family childcare. This is sort of how we approach almost all things for early care and education, right? We're sort of told, here's the amount of money you have to work with. The 40 million things you need to do with that money far outstrip the amount of money, and we just work with that scarcity. We try and make that amount of money that we've been given work in trying to achieve these really lofty goals for young children that we are all committed to because they're so important for their development and the development of their families. But it's that kind of leftover. It's like, what can we squeeze out of this small amount of money? And then what's left over to, in the case of family childcare, is frequently the kind of leftover element of the childcare system. And that's something that this particular core belief is pushing on, trying to change up. So that if you're thinking about it as part of the fabric of your mixed delivery system, then understanding the resourcing that it needs is part of having that big number for your investments as well. So what we're going to do now, and I'm not sure if we made this clear at the outset, is that we were holding introductions of you all to a little bit later in the webinar. And so we're going to shake it up and make sure that we haven't, that I haven't just lulled you into a post-lunch sleep at this point, especially for my East Coasters, who it's already almost 2 o'clock. We want to go state by state. And what we've done is we've split the group into 2 sets of introductions. And in part, not totally linear, but we felt that there were some states that were sort of better or suited or more aligned with the first 2 core beliefs. And some of you, what you're working on is a little bit better aligned with the 2 core beliefs that Jessica is going to introduce in a little while. So that's how we've broken it up. So we're not just going to do straight introductions across all the teams in one big block. We're going to have 4 states, and you see yourselves there on the slide right now, are going to start us out. And what we want to do here, and so there may be more than one from Idaho, or it may just be Malia today. We want to have you introduce yourself and make sure all team members introduce themselves as well. So we kind of have your video box come to the top of the screen for us all at the same time. And then we want to hear a little bit about the goals or your initial thinking on this COP and what the benefit and what you're hoping for out of the work of the COP. Let's go to Louisiana.
Hi, good afternoon.
Hey, Tanya.
I believe I may be the only one on my team on the call, so I'll just go ahead. Well, first off, let me just preference that I am very new to the field of family child care. I work with the Louisiana Department of Education in early childhood, and I am the family child care pilot manager for our state. So I am 6 weeks on the job. So I may not have a lot of insight to lend, but I really would like to be a thought partner and be able to receive some of the information and the wisdom that's coming through by all of you guys. And I've enjoyed so far. But what I can say is this is where we are in the state of Louisiana for family child care. Really quick, is that for so long, like many, they have been forgotten and undiscussed. And we have at least began putting a spotlight on our family child care providers. We have, we're in the 2nd year of a pilot program where we are providing them with lots of supports, leveraging them with supports and QRIS, lots of things that we're trying to put into place, but also working on understanding their unique needs and challenges, and also where we can go with policy from here. And that is the big picture item that we're really trying to put a lot of effort into. So getting some help in that area with this group of thought partner would be phenomenal. But that's really on our radar. That's the work that we're pushing through right now.
So how about we go to Danielle in New York and the New York team?
Sure. And then I think I've got Karen and Helen both on as well from New York. So I'll start off by saying I'm Danielle Demuse. I'm the policy analyst for Committee for Hispanic Children and Families. We're one of the CCR&Rs in New York City. And so this work is very near and dear to us. We work very closely with specifically the family child care sector, overwhelmingly Spanish speaking providers. And we've been active on local, like city advocacy spaces, as well as state and federal. And this is always the piece that we're coming to, trying to, edge in family child care as an explicit part of that conversation. And it meets challenges, right? There's a larger context of child care that we come up against, which is why the second core belief really just stands out. It's about making sure there's an equity lens here and including this sector and honoring family choice of that sector. I think that's a really big piece that we always hear like thrown around by our Department of Education, who just took over our early care system in New York City, by the state. But at the end of it, if there's an unwillingness to like equitably discuss this part of the sector as part of the whole sector and equitably resource and support and invest in, that's what we take issue with, because that means that you're inherently not investing in where families choose to put their children. Overwhelmingly in New York City, that's, communities, low-income communities and communities of color and immigrant communities. So ever on that effort to like push for that and make sure that we're growing the discussion to be inclusive is what we're kind of hoping to get out of this. And we know that there are some states on this call that are more advanced on this, have been doing tremendous work on growing out networks and hubs statewide, and making the family child care sector an intentional part of the larger sector. So we're really looking forward to hearing, you know, strategies and ways to kind of move in that direction for New York. And I, not to like step on what I know, or at least I know part of what CUNY PDI and the Quality Stars team, who's also on from New York, will speak to, but there's also an intentional focus on investment in workforce development, right? How are we connecting our providers to professional development opportunities that help invest in themselves and then result in, you know, pay equity, pay parity, and make sure they're getting really, you know, a respectful pay for the really important work that they do, which is definitely not happening right now in New York. So I'll pass the buck over to either Karen or Helen, whoever wants to speak from Quality Stars and CUNY PDI.
I'm Karen Spurb. I'm a quality improvement specialist for Quality Stars New York. It's the quality rating improvement system for our state. And I do work closely with a lot of family providers, and I can echo with what everybody's saying, especially what Danielle was saying about pay parity, recognizing their work and valuing their work. And it's exactly like what everybody was saying about, you know, high needs communities and family childcare providers, especially with COVID. I see them suffering so much and not having supports, financial supports also. And I deal with a lot of programs that have illegal immigrants, and it's scary what's happening out there. And the supports that those individuals need, especially like a lot of frontline workers that do depend on childcare. And in New York, a lot of programs are closing. And I feel that it's gonna get worse. And I'm really looking forward to learning from every one of you. Thank you.
My name is Helen Frazier, and I work at the New York Early Childhood Professional Development Institute, and I'm really honored and curious to be in this space and be part of this call. Part of the work that we're doing at the Institute right now is working on the revision of the career ladder for New York State. So as we think about structures that can, you know, really hold up and be inclusive of family child care, and as we think about the career ladder, I would really love to get guidance and feedback from this group on how to do that intentionally.
My name is Malia Wisner with the Idaho Stars Project in Idaho. I am one of the Idaho Stars Idaho Stars Leadership Directors at Idaho AUIC. We have two main groups in Idaho who support all of our quality interventions and CCDF dollars. That's through Idaho AUIC and the U of I. And I'm lucky enough to be joined by two team members. I'll let them introduce themselves quickly. Laura, do you want to say who you are and what you do with Idaho Stars?
Yes, thanks. So my name is Laura Thomas, and I'm here in Idaho, and I am the Child Care Resource Center Assistant Director with Idaho Stars. And I'm just very excited to be a part of this group.
And then Chelsea as well has joined us.
Yeah, and my name is Chelsea Crema. I work with Malia at the Idaho AUIC office on the Idaho Stars Project, and I'm the equity coordinator. And so I support all of the pieces and parts of all of Idaho Stars work, from our QRIS systems, our professional development, really everything in promoting and evaluating our equitable impact.
And so the three of us, plus hopefully more team members along the way, as we start to build our team, are really, I feel like Idaho's really at a interesting jumping off point. I think much like I've heard here, there has been a lot of focus, especially on our quality interventions through the center-based lens. What we know about our QRIS system in particular in Idaho is that of the currently 144 programs who are verified at a step, only 20 of them are home-based programs. So we're really looking at one targeted strategic move of increasing enrollment into and verification at a step for home-based programs into our state's QRIS called Steps to Quality. We really see that not only as an area of opportunity for helping children, especially those who receive subsidy and receive care in home-based settings, to then have access to quality improvement interventions, but also as an equity step on the part of our organization in really looking at how to provide equitable business support for those business owners who are providing childcare out of their home. We've looked at our data in our state, and we know that the vast majority of facility administrators in centers are white and speak English, and the higher majority of individuals who run home-based programs are Black or Brown and might not speak English or might not only speak English. And so from an equity standpoint, we really see this as an opportunity to grow quality and equity in a really big way. We also were just recently PDG award winners in our state. So we're just finishing our first year. We have a 3-year expansion that cross all your fingers and toes and eyes that we get. And there's a component of broadening support to home-based providers in that, including specifically a home-based provider community of practice and other potentially funded strategies to help us really provide more quality and equitable focus on this really important part of childcare in Idaho.
I'm going to turn it over to Jessica now to take us into core beliefs, starting with core beliefs 3 and 4, and then the rest of the intros.
Thank you, Gina. Hello, everyone. I'm so happy to see all of you, some familiar faces and some new faces. I am excited to be part of this COP team and looking forward to the journey together. So we've had such great discussion, and just listening to the work that the states that have introduced themselves that are doing really is quite impactful. I have spent all week on provider calls with family child care providers as part of our fiscal work in New Mexico. And there's really nothing like getting financial information from a family child care provider to understand the realities and the challenges that they encounter. But so this is a nice way to end my week, to really talk about how we move this work forward and understand these core beliefs and use this to drive change and do great things in our state. So the third core belief that we are looking at is the idea that the strategies that we put into place to work with family child care providers in their settings should really be responsive to their needs and reflect the unique challenges and situations that they encounter. You know, Gina mentioned earlier on, family child care providers are doing the work of, you know, maybe 10 people at a center. So it really is a nuanced model in the sense of how we support them. And I think one of the most important things to look at is that we really need to take the time to identify what family child care providers' needs are and do it in an intentional way to ensure that we are listening and that we are truly meeting their needs. So some of the work that you know, states have done in the past to get provider feedback have included things like surveys or interviews that have been embedded in the larger childcare system. So maybe not as nuanced to the needs of family childcare providers. So it really is looking how to get the leaders in the family childcare field, get their voices heard, and how to use these approaches to embed this in their opportunities for leadership. So we really need to ensure that we are thoughtful and responsive and truly creating I think Idaho just said they had a community of practice for just family childcare providers. I think that's a great strategy in how we move forward, because in order to be represented, they need to be heard. So our core belief number 4 is that family child care needs to be approached in a systemic way across all the various federal initiatives and private funding opportunities. And that we need to do that in order to leverage these fully while also keeping a laser focus on best practice for FCC. And Gina talked a little bit about the funding challenges and the just the lack of resources for childcare in general, and then family childcare even suffering even more. So one of the things that, you know, states have been doing and communities have done is really looking at how to layer funding and how to create a stronger system at the state level as well as the community level because of that parallel process to ensure that that family child care is embedded into the work of the overall ECE system. And I give the example of early Head Start partnerships because that is, you know, one tool to be able to leverage federal dollars into family child care homes. Obviously, it's a process, and as you've all mentioned, everyone's kind of in a different place for where they are in this family child care journey. So it really is looking at your systems in place and who's at the table and ensuring that it can be done. And whether that means strengthening your current systems to work together, creating stronger systems at the community level that then your state systems can work closely with. It really is an opportunity to look at funding resources and pair them up to increase quality as well as increase access. And as someone mentioned in the beginning, we don't want to ever have to choose between access and quality. So layering funding, you know, the federal initiatives can really support that work. And also the importance of the relationship aspect, right? So we talk about the relationship-based approach that we have when we look at family child care home. It's also very important to take that into consideration, you know, when there are state partnerships along with community partnerships that are providing the support for family child care homes. So I am going to move us on to our second set of state introductions. The first set of introductions, we're looking for names, your team member names, and the goal for the COP. And I believe, I can't see everybody, and I'm not 100% sure who is who from each state. So I'm gonna ask my colleagues, Gina and Danielle, to help me with that. Yeah. But maybe Nebraska.
Yep. So we need another Nebraska.
Our fearless leader, Amy Bornemeyer, is with First Five Nebraska, and she will be leading our team. I am Brandy Langle, and I'm with the Nebraska Early Childhood Collaborative. And we have a family child care network, a formal one that we launched this summer. So we're working with providers across the state on varying levels of support. Just getting ready to launch a Family Child Care Network Advisory Council where providers will be able to inform us of our work, really strengthen what we're doing and make sure that we're meeting the needs that they have. I think there might have been at least one other person from Nebraska that was on the call, or was. Maybe it's just me.
Well, welcome.
Thank you.
Maybe we could call on Angela Birch from North Carolina.
Hi, thank you. Yes, I'm Angela Birch from the North Carolina Early Education Coalition and Think Babies project manager. And we are, through our recent continuation of funding through Pritzker and other sources, are forming a family child care home advisory team, and members of that are going to filter into this community of practice. And I'm super excited that several of them have joined us today. So I think it's best that they introduce themselves and kind of give a little bit about what they're looking forward to. So we'll start with Lori Jones.
Good afternoon, everybody. My name is Lori Jones. I work for an agency called Southwestern Child Development Commission, and we are a part of the CCR&R Council here in North Carolina that is a partner agency with the North Carolina Division of Child Development and Early Education. So we work in partnership with them to help support the CCR&R system here in North Carolina. One of the things that I picked up on that Tanya mentioned earlier from Louisiana was that she's been in her position about 6 weeks and is new, and she's probably in that fact-finding mode. That's kind of where we were about a year ago. We received a position from the Division of Child Development to take a year to just kind of analyze where we were in the state with family child care. So we've been very busy doing that type of work. And so we are anxious to try to kind of embed some of the things that we learned, particularly from our family child care home providers, into this ongoing work. So I'm excited to be a part of this and excited to hear what other states are doing as well. I'm making some notes as I go. So thank you, everybody.
Thank you, Lori.
Great.
Gina Puckett.
Yes. Hi, I am Gina Puckett. I'm the program director at Child Care Resource Center. We're one of the regional child care resource and referral agencies. North Carolina is interesting in how it has some pockets that have worked with family child care for many years. Our particular organization, funded by Smart Start, has had a what people are calling staff family child care networks now, but that's not been the term we have used, but it was funded since 1996. And so, and I've been part of that for 20 years now, almost 21. But we work with the family child care home providers in Forsyth County, the Winston-Salem area. And we have worked with them through licensure, through professional development training, through the quality improvement system, through marketing, through working out behavioral issues, and just being a support system. We provide training and individualized on-site TA and coaching, and a community of practice for our home providers. And it's been a really beneficial support system for our home providers. We, like everyone else, are facing a decline, a sharp decline in the numbers of home providers. That has happened through the years. We have always had lesser turnover than the national average by having this support system, but it does not offset the compensation issues that are related to family child care. I worked as a family home provider in my own business for 10.5 years prior to starting this work, and worked as an individual coach with home providers. And then I am now the program director who supervises others in that role. So I've been in it a long time. I'm very excited about it. The state of North Carolina has not done much with family, friend, and neighbor care, and we are piloting a project here in Forsyth County with funding from a private foundation, the Kate B. Reynolds Charitable Trust, around using Play and Learns as a tool, a mechanism, strategy for reaching out to family, friend, and neighbor care. So there is some exciting work that's happening here. I think as this pandemic in particular has shown, family child care should be a valued part of the early education ecosystem. And so I'm excited to be part of this group.
Thank you so much, Gina. We're glad you're here. Lewis Finney.
Hey, good afternoon, everyone. I'm in North Carolina. I'm the president and CEO of Smart Start for Forsyth County, and we pretty much fund the education system from 0 to 5. One of the programs is the great program that Gina talked about and all the work that she does with family child care providers. We also fund Head Start programs and child care subsidy funds, particularly around the BMC pre-K program, which is in the state of North Carolina, and how we fund particular programs. On my other hat, I've been active with family child care providers probably for the past 15 years, particularly around funding the federal dollars. I'm also the current president of the National Association for Family Child Care, and we're an accrediting body for family child care homes. We're also the advocacy group and lobbying family child care homes across the country with the individual state associations, but also we have membership in foreign countries as well on military bases. So glad to be a part of this group to get some insight, learn some new things for different states, but also share some things that I've gotten from different states regarding family child care as well. Glad to be here.
Thank you so much, Louis. We're glad you're here as well. We're not done yet. Let's go to Katrina Chance.
Buenos tardes, everyone. Good afternoon. I'm Katrina Chance, the Executive Director for the Richmond County Partnership for Children, and I'm glad to be part of this COP and to continue the great work that we're currently doing here in North Carolina. I will be brief since my colleagues before me have mentioned some of the great work that we're currently doing here in North Carolina. We also here at our partnership, we do have the resource and referral CCR&R, so I'm excited to continue the work with our family child care providers. And I actually call them professionals and educators because that's exactly what they are. So it's up to us to continue to change the language and develop that out in our community, and so that everyone understands that they are professionals and educators. So thank you all for allowing me to be part of this group, and I look forward to what we all have to offer.
Thank you so much, Katrina. Wendy Price.
Hello, good afternoon, everyone. My name is Wendy Price. I am with the Child Care Services Association here in North Carolina. I work with our Child Care Resource and Referral, specifically with our Technical Assistance Department. I'm an instructional support manager that provides support to our teams that provide technical assistance, training and coaching and consultation within our regional CCR&R. I am excited to be a part of this community of practice. Most recently, I've been more on, focusing on ground level work, and but one of my passions is to be able to provide support and be a part of statewide work. So, and specifically around family childcare homes. So I'm excited to be able to share with you all some of the things that we're doing at Child Care Services. In North Carolina, one of the things that I have noticed or observed over the past few years is, we've really been focusing on the child care facilities and being able to bring that focus back to the family child care home community is something that I feel like, I'm very proud that we're a part of this group, and that, our state leaders have been able to recognize, the importance of bringing a focus back on family child care again. So good to be a part of this group.
Thank you, Wendy. We're happy you're here as well. All right, two more. Okay, she moved. Laura Hewitt.
Hey there, I'm Laura Hewitt. I work with the Division of Child Development and Early Education. I'm the Child Care and Development Fund Coordinator. I just joined you at 2, so I missed some of the good introduction for context to introduce myself, but I can say I'm looking forward. We're getting ready to start the 22-24 plan, and I look forward to hearing more even from within my own group about what's happening across the state with family childcare homes so that we can incorporate it in our CCDF plan for the next cycle. Glad to be here.
We're glad you could join, Laura. And our final member that is on the call now, Danielle Caldwell.
Good afternoon. Thank you so much for having me. I'm a 25-year family childcare veteran, and I have been asked to be a part of this group because I've been on many committees and on boards, and I always rally for family childcare homes for some of the reasons that you mentioned right here. When we talk about being culturally relevant and we talk about kinship care, that is the sector, family childcare home, that a lot of parents prefer. And when we talk about choice, I like hearing all of the things that I've heard so much, but most of all, the practices in family child care home, if we could drill down to the practices that really work, I think we could bring credibility and professionalism to this industry. And so I am so happy to be here to share and to learn, and let's get working.
Very good. Thank you so much, Danielle. We're particularly happy that you were able to join us as well. All right, well, did I miss anybody from North Carolina? I checked my list twice. Okay, all right, back to Jessica. Sorry.
Thank you, Angela. No, thank you, North Carolina. Happy to see all of you. We have just 2 more states left. I just want to make sure we give everyone time. Pennsylvania, I believe Sharzi, if I'm saying your name correctly.
You are saying it correctly, and I'm pleasantly surprised by that. Thank you. I'm Sharzi White. I am the Director of Coach Development here in Allegheny County on the southwestern side of Pennsylvania, and we deal with providers in Allegheny County. ELRC stands for our Early Learning Resource Center. So I've heard some people say that, you know, they've been doing this about a year. Well, we became the new contract holder. My lead agency is Trying Together. So there's 2 other folks, I believe, on the call from Trying Together. My lead agency is Trying Together, and they've taken over part of the quality initiatives aspect of our QRIS system here in Pennsylvania. So we've been doing this for about 18 months now, and we've learned quite a bit. And we are very fortunate to have been able to construct our ELRC, to have what we not only have our crew of coaches and designators that oversee that and work with our regulated family providers. We also have what we call relative neighbor family providers, or I heard someone else refer to it as kin provision. What they do is we have a group called Early Learning Program Engagement Specialists. So we have a whole separate team that actually gets to work directly doing coaching and mentoring for those folks that have chosen not to be regulated and do family care. And then we have our platform of the coaches and designators that work with regulated. And because we're all from the same organization, we have an amazing opportunity to combine resources and to collaborate on all the quality. And what the amazing thing is working with the program engagement specialists and their supervisor is that they naturally will work with those folks that have chosen not to be regulated at this time to meet quality right where they are, whatever it is to them, where it means for them right there. And then they can educate them, and then we can get involved on the regulated side to encourage them and share the knowledge in case they want to make that step over. There are a lot of other things that Trying Together does as an organization. We have learning hubs that are already up and running. Our early learning program engagement specialists do a COP weekly with our family providers. But we have also noticed there's a huge difference, right, between folks that are group, because Pennsylvania does family, group, and child and center-based programs. There's such great disparity and differences between what families need from a COP as averse to a large center. So we've been very fortunate to be able to bridge that gap and provide that, but we definitely need the support of other people across the states to see what they're doing to make a bigger impact and to really get to know what those families need at where they are right now. We are a relationship model, as I've heard other people say, and we will take the time to do whatever it needs to meet them where they are and move them forward. I'm gonna let Judy talk a little bit about, Judy Grassa is also on the call. I can let her talk a little bit about some of the things that she's been involved in with family providers and regulated, non-regulated, and community-based.
Yep. Hello, everybody. I'm so happy to be on this call as well. And we also have Shalonda Spencer with us from Policy, Trying Together's policy team. So my direct experience currently is I am a Keystone Stars quality coach and a designator. So I work directly with providers, both family, group, and center providers on navigating the quality standards and offering them technical assistance, one-on-one technical assistance, coaching, and direct support in that manner. And I love how right now what's going on in the state, you know, in the past year and a half since Trying Together has taken over the quality piece. And what I've seen is that the increase in community hubs and community organizations and having these hubs directly in neighborhoods so that providers, and I think it's a better outreach for family providers, have easier access to, you know, if they have questions about CCW invoices, if they need to, you know, turn in any paperwork, if they need direct resources for any of their families that might be experiencing food insecurities. So I love these hubs, these idea of the hubs and the relationship based model. So in the next few weeks, I'm going to be making a transition from the quality team to Director of Quality Initiative Projects, which will be a new role for me. And from what I understand there is that there are several, Trying Together has several initiative neighborhood projects that they have secured funding for that work, most of their work is done with family providers. And so some of the goals that I think I'm personally, like I'm absorbing everything that everybody's saying, some of the goals that I think I personally want to work on without knowing as much yet about the programs is the shared services organizations. I know they've already started those groups in different neighborhoods and they're already utilizing that, but how do we maximize on that? And then doing like some cross projects to maximize on the resources and get the best benefit, especially for those family providers. So lots of good stuff going on in Allegheny County, Pittsburgh, and I can't wait to hear about what Sholanda's got to say. So I'm jazzed to be here. Thanks.
Hello, everyone. My name is Shalonda Spencer, and I'm actually with Trying Together along with Sharzy and Judy. I'm new to the team. I just became the Director of Public Policy and Government Affairs. I'm originally from Mississippi, of course. So I'm very excited to be in the Pennsylvania area, and I'm excited to join this group of amazing people who are doing this work. I'm not a veteran in early childhood education. I am actually a newbie, but I'm learning a lot as I go along. I have a team of 3 with my policy team, and we focus on 3 major campaigns that we serve in Southwest Pennsylvania, which those campaigns starts with, it's a Start Strong campaign, and it focuses on infants and toddlers, and we advocate for and we do a lot of advocacy around investing in early childhood education. And then we have pre-K, of course, that's ages 3 and 4 years of age. And then we have our home visiting model that we also provide a lot of resources for. And we have 6 programs under the home visiting model, which is early Head Start. It also provides resources for child delivery and support services for families, for like new parents and new moms and new dads. Family Checkup, Healthy Families for America, which we promote positive parenting under that program, along with nursing, family partnerships, and parents as teachers. So right now we are just basically have been working on our policy agenda, which we focus this upcoming year around racial and equity and justice pieces in our new policy agenda. And we're looking forward to sharing that with other organizations and hoping that we can really bring some new legislation that will give early childhood education a glimpse of like what it means for equality for all children. So that's basically what I do and what I've been working on with my team.
Thank you so much. All right, and I think we have Kelly from Wisconsin on.
Yes. Wow. I feel really lonely being a team of 1 after North Carolina paraded through and Pennsylvania, Allegheny showed up. But yes, I'm a mighty team of 1, but have sort of relationships and representation that I'll be sharing all of this work with. So I am currently the co-director of our shared services model called WESN, the Wisconsin Early Education Shared Services Network. We explicitly serve family providers. As a former family provider myself, that was baked into our model from the get-go. About half of our programs are family providers, and the services we provide to them can be family childcare specific, professional development, tax information. We have a team of currently 12 coaches. So I started as 1 half-time employee for our shared services network, and we won a systems change grant in 2018, and we took 2018 to 2019 to sort of do our implementation, development, build the relationships, get the feedback from providers and all of that. We launched in 2019 with 2 providers, 1 group and 1 family, and we now serve over 130 programs in 11 counties in Wisconsin, with future expansion in the works. I am an employee of our AEYC, so WICA. We are old enough to have outlasted the AEYC naming. So we're the Wisconsin Early Childhood Association, and that houses our shared services model. And through the AEYC, we do a ton of advocacy work. We do policy development. We are convening the Pritzker infant toddler team for our state. And we just were awarded PDG funding this last year and are waiting to hear how this work moves forward next year. Our shared service model has been written into our PDG strategies. So our state is very much behind this notion of bringing shared services to more providers. It is very relationship based. We meet providers where they're at. As of last night, I was literally pulling together an evaluation of a supply box that we received from our Department of Children and Families because it's taxable income and providers didn't know how to handle that. So, I mean, it is from that sort of thing to COVID crisis to financial management. We also have bookkeepers that we were able to hire on as financial specialists. So if programs are interested in offloading that portion of their life and paperwork, we can actually help with that as well. So I'm excited to be here. I'm excited to learn more about what's going on in other states. We've been approached several times in the last 2 weeks about providing sort of boot camps for unregulated providers or folks who want to get into the business. So thinking about how we might package something like that to support those providers coming in and the community groups that want to support them through financial support, removing some of the barriers to getting started, that sort of thing. And then I also helped write some of the QRIS quality standards for family childcare, especially around business practices and tech stuff, because that is my area of specialty and I love being a nerd in that area. So yeah, that's a little bit about what's going on in Wisconsin.
Thank you so much, Kelly. Great work.
Thanks.
Now I will pass it to Gina.
Yeah, because I believe that there's not anyone joining us from New Mexico today. So we just want to thank you all for taking the time to share not just some of the goals that you have for the COP, but the context in which those goals are coming from. I think that's really valuable for us all as we think about how to work together. We want to spend just a couple minutes before we wrap today's discussion to share with you the electronic platform that we will all be part of as a community and have Cheryl McAfee from the Build Initiative introduce the exchange. We don't have as much time for Cheryl as we would have had, but this is really just an intro to the fact that you're going to be part of this platform, and there will be opportunities for more guidance on what's available to you there and how to access it. So Cheryl?
Thank you. It's really great to be on this call and hear all the exciting work that you're doing. The NCIT Exchange is a way that you can stay connected. It's an online community that connects the broad network of PN3 leaders and experts for peer learning, problem solving, and knowledge sharing of all kinds, so resources and whatever. The HBCC Community of Practice neighborhood is part of this larger exchange community, and it'll give you a private space to focus on this particular work as you're holding these community of practice meetings. It's a place to share resources, post and continue discussions, post questions, and be alerted to events of interest to the COP. You don't have to wait until the next meeting to post new insights or ideas or questions. You can stay connected at all times through the exchange. You'll receive instructions on how to set up your profile. You can go to the next slide, please. So you'll receive these instructions on how to set up your profile and how to sign in. Please note you can choose to receive email alerts as real-time email or daily or weekly digests. It's listed under your profile settings for email digests and subscriptions. And you can opt into discussion notifications by turning those on the forums page. Once you get in and start using this, I think it'll be fairly intuitive. But know that I'm always available to help, and Chloe Jordan is also available to help. I'm sure those emails will go out, how you can reach myself and Chloe. And I think I'm just going to speed through and just end it there so that you have time to wrap up in the next 2 minutes.
I'm going to speed through those slides and we're going to come to our concluding slide. And as Gina mentioned at the outset, we want to thank all of you and all of the teams that are able to participate today. We do anticipate having some of our other team members. Some had let us know some things had come up at the last minute. So they really look forward to meeting with you in the coming weeks. Our next convening, as Gina mentioned, will be on the topic of shared services, and that will be one of the national webinars, and that'll be the event we invite you to attend, but solely for the community of practice. For the half hour following that webinar, we'll have a debrief, and as Gina mentioned, we'll send out some questions in advance to be thinking about some resources to look at prior to the webinar, so we can really dive into how it specifically relates to you and your goals, and where do you want to take that information next. Our next meeting, where we'll all be together focused solely on community of practice issues and communications, we'll have a meeting in February, and we're going to have a pattern of the third Tuesday of the month from 12 to 1:30 Eastern. So you can start blocking some of those times off on your calendar. We may not have exactly what it's going to be, because a lot of that's going to be directed by you. But those are the times we're blocking to be together. We do want to ask you alert you that this session was recorded for those that could not make it. We'll be providing the PowerPoint, and please also be on the lookout for an invitation to participate in the exchange, the NCIT exchange that Cheryl just mentioned. We'll then be using that to post updates, links, resources, events, engage in conversation before and after our upcoming connections with one another. We'll be monitoring that on a regular basis. And we really, really, once again, look forward to just getting started with all of you and getting to know all of you better in your states and communities. So thank you for your time. Gina or Jessica, any closing thought?
Thank you all. It's great being on here with everyone.
Have a good holiday season, everyone, since we will not formally see each other again before then.
Absolutely. Thank you. Thank you all.